Hi everyone, welcome back to my YouTube channel, and today we are going to talk about coronary artery disease. So let's start our topic with introduction. Coronary artery disease, also known as coronary heart disease, is one of the most common cardiovascular disorder and a leading cause of morbidity and mortality worldwide. It occurs due to narrowing or blockage of the coronary arteries that supply oxygen-rich blood to the heart muscle. Coronary artery disease develops gradually over many years and can lead to serious complications such as angina, myocardial infarction, heart failure, and certain cardiac death. Anatomy and physiology of coronary artery disease. The heart receives its blood supply through the coronary arteries which arise from ascending aorta. There are two main coronary arteries, the left coronary arteries which divide the left anterior descending artery and the circumflex artery. Then there is right coronary artery which supplies the right side of heart and parts of conduction system. These arteries develop oxygen and nutrients essential for the normal functioning of the myocardium. Any obstruction in these vessels compromise blood flow leading to ischemia and tissue damage. Definition of coronary artery disease. Coronary artery disease is a condition characterized by accumulation of fatty deposits, cholesterol, calcium, and other substances in the inner wall of coronary arteries. This process, known as atherosclerosis, resulting in reduced blood flow to the heart muscles, causing chest pain and increasing the risk of heart attack. Etiology of coronary artery disease. The primary cause of coronary artery disease is atherosclerosis. Several factors contribute to its development, including damage to arterial endothelium, lipid accumulation in arterial wall, chronic inflammation, and formation of atherosclerotic plaque. Over time, plaque harden and narrow the artery, and rupture of plaque can lead to clot formation and complete arterial blockage. Risk factors. Risk factors are divided into modifiable and non-modifiable factors. Non-modifiable factors include increasing age, male gender, genetic predisposition, and family history of heart disease. Modifiable risk factors include smoking, hypertension, diabetes, hyperlipidemia, obesity, sedentary lifestyle, unhealthy diet, excessive alcohol consumption, and stress. Pathophysiology of coronary artery disease. Pathophysiology of coronary artery disease begins with endothelial injury which allows low density lipoprotein cholesterol to penetrate the arterial wall. Then this oxidized low density lipoprotein trigger an inflammatory response leading to formation of foam cells and fatty streaks. Over time, fibrous plaque develops narrowing the arterial lumen, and this reduced blood supply results in myocardial ischemia, especially increased oxygen demand. Plaque rupture can cause thrombosis leading to acute coronary syndrome or myocardial infarction. Clinical manifestation of coronary artery disease. Symptoms of coronary artery disease vary depending on the severity of arterial blockage. Common signs and symptoms include chest pain or discomfort like angina pectoris, pain radiating to the left arm, neck, jaw, or back, shortness of breath, fatigue, palpitation, nausea, and sweating. Types of angina pectoris are stable angina that occur during exertion and is relieved by rest. Second type is unstable angina that occur at rest and is unpredictable. Third type is venous angina that is also called as Prinzmetal's angina, and it is caused by coronary artery spasm. Diagnostic investigation involves a combination of clinical assessment and diagnostic tests that include electrocardiogram, blood tests for cardiac biomarkers, exercise stress testing, echocardiography, coronary angiography, CT coronary angiogram. These investigations help determine the extent of ischemia and arterial blockage. Management of coronary artery disease. Management aims to relieve symptoms, prevent disease progression, and reduce complication. The first way is medical management that include antiplatelet drugs such as aspirin, statins for cholesterol control, beta blockers to reduce heart workload, nitrates to relieve angina, and ECE inhibitor for ARBs for blood pressure control. Then there are surgical and interventional management that include percutaneous coronary intervention, that is angioplasty with stent placement, and coronary artery bypass surgery. Then there is lifestyle modification that play a vital role in managing coronary artery disease that includes smoking cessation, regular physical exercise, healthy diet that is low in saturated fat and salt, weight management, stress reduction, and control of blood pressure and blood sugar level. Complication of coronary artery disease. If untreated, it can lead to myocardial infarction, heart failure, arrhythmias, cardiogenic shock, sudden cardiac death. Prevention of coronary artery disease. Prevention strategies includes early identification of risk factor, healthy lifestyle practices, regular medical checkups, and adherence to prescribed medications. Conclusion of this lecture video. Coronary artery disease is a major global health concern with significant impact on quality of life and survival. Early diagnosis, appropriate medical and surgical intervention, and strict lifestyle modification are essential to reduce morbidity and mortality that is associated with coronary artery disease. Public awareness and prevention play a crucial role in controlling the burden of this disease. And this was all about coronary artery disease. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.